Axel Meyer, AbbVie, a Trojan Horse strategy for brain delivery and therapy.
About the Trojan Horse strategy and how we use it to bring antibodies into the brain. Now, next. Okay, next. Okay, why is industry interested in antibodies as CNS drugs? There's a higher success rate for late-stage compounds to really reach the market, and also there's shorter development times, which makes development less expensive. Next. But the major problem, or one of the problems, is that nearly all large molecules, like antibodies, are almost unable to cross the blood-brain barrier and to reach the brain. And therefore, if you take, for example, a therapeutic antibody, only about 0.1% of the injected dose actually goes across the blood-brain barrier and makes it to the brain. And I think that explains why why 6 out of the 2015 top 10 selling drugs are biologics, but none of them is directed against the CNS disease. Next. And that shows that the blood-brain barrier represents a major hurdle in CNS drug development that we have to overcome to enable antibodies for CNS drugs if we don't want to, next, hit a brick wall. Next. So, next. To avoid this, we use the Trojan Horse strategy, and that basically is described here. So we start with, what we use is a receptor on the blood-brain barrier, here termed 1, and the drug itself, next, can't cross the blood-brain barrier, but when we conjugate it to, for example, an antibody against the receptor R1, what's happening then is that this conjugate can bind to the receptor, it can then be transported across the BBB, released on the others, transported to the brain side, released, and the drug can act to its target. And at AbbVie, we are using our dual variable domain, or DVD technology, in which we combine variable domains against 2 different antigens, here called X and Y, in one molecule. And for the Trojan Horse strategy, we are using a transport-relevant domain with a disease-relevant domain. Now, the question, of course, is, does it work? And for that, we have generated so-called Trojan Horse DVDs, next, in which we combined variable domain against transferrin receptor with a therapeutically relevant domain. And what you see here is that neither the target antibody nor the control DVD make it to the brain, as you see from the lack of the brown staining in the left 2 pictures, whereas only the DVD itself makes it to the brain, as you see from the brown color, which is only possible if the DVD crosses the blood-brain barrier. And what we also see in this figure below is that the DVD itself works significantly better than the target antibody or the control DVD. And therefore, we think that that Trojan Horse DVD represent a promising approach to enable the use of antibodies in CNS diseases. And this is the work of a number of scientists from different AbbVie research sites, from different sites within the company. Thank you.